Shoulder pain is keeping you up at night, or you notice pain when you're trying to lift things, it's time to reach out for help. Dr. Kruse, Dallas's shoulder specialist, joins us today with his patient, Lane Sorgen, to talk about the state-of-the-art solutions he has to offer minimal recovery time. Good morning to you both.
Good morning.
All right. So, Lane, tell me a little bit about how long you lived with shoulder pain and maybe what prevented you from reaching out for help sooner.
Yeah, sure. I injured my shoulder over 20 years ago, and I had pain on and off for a while. But about 5 years before I had the surgery, it started to hurt all the time. I mean, literally all the time. And it got progressively worse. And so I went back. I actually had labrum repair on my right shoulder. And so I went back to the same surgeon thinking I'd have the same thing. And he said, "You're going to have a replacement." And I thought, ooh, that's not good.
Yeah.
And so I did a little search on the internet. I talked to some friends about that had shoulder surgery, and they told me, don't do it.
No.
And so I decided I'm just going to live with the pain because, you know, it's a big surgery.
Yeah.
But the pain got worse and worse. And I remember in particular one day about six months before the surgery, went to pass the football with my son, and catching it, the impact of catching the football almost brought tears to my eyes.
Oh, wow. It was unbearable.
I kind of
at
had
that
to
point.
rethink that decision.
Wow. Okay, so then you got the surgery. What changed after that?
All right, everything. I had no pain.
That's awesome.
I had no pain whatsoever. You know, you got full range of motion. One of the things that I notice even today is the little things. And so, you know, like hugging your family, that would be painful.
Wow.
Driving a car with two hands or 10 and 2.
Simple things, yes,
yeah,
yes.
that would be painful.
So, Dr. Kruse, have you seen patients like Lane who maybe hold out or wait just a little too long to get help?
Yeah, thousands for
Wow.
sure. It's a common story.
Okay, so you say that your patients recover quickly when they do have the surgery. Tell me a little bit about the recovery and how do you manage to make that happen?
So I think we do a lot of things to help accelerate the recovery of our patients. You know, it really boils down to the techniques we use, the technology we use, the teams of people that we have, and really being hyper specialized in the shoulder.
Yeah.
You know, for Lane's surgery, we used a minimally invasive technique to replace his shoulder with a bone sparing type implant. And I think because of those things and our accelerated rehabilitation programs where we don't make people wear slings as long, it allows people to get back to their life as quick as possible. Nice.
Okay, and a consultation is probably really important.
Yeah.
So tell me what people can expect when they come see you that first time.
Sure. I think one thing we pride ourselves on is getting patients in quickly, so we don't have long wait times. We've got a large team that helps manage that. You're going to come in, and what's going to happen is you're just going to tell us your story. You know, and everybody's got a unique story, and we're going to listen, and we're going to understand what's been going on in your life and how is your shoulder holding you back. We're going to do a quick exam. We're going to look at all your tests, and then we're going to figure out what's wrong with your shoulder, and we're going to fix it.
There we go. Simple and easy, right?
Mm-hmm.
Tell them, Lane, simple and easy, right?
Simple and easy.
There
no
we
pain
go.
At all.
Well, thank you guys so much for joining us. Dr. Kruse has offices in Dallas and in Plano. Go online to book your appointment today at kevincrusemd.com, or you can call 214-390-3815. Again, that number is 214-390-3815.